When using the indications or a quick link for indications on the DX2, you want to be aware that the protocols are based off of clinical studies that have been peer-reviewed and published. I also want to make sure you're aware that all the clinical indications do default to pulse shortwave diathermy versus being used in the continuous mode. Let's start out with one of the more popular indications for use, which is microcirculation. Again, because of what I've discussed earlier, the high efficiency auto tuning that allows us to control that low dosaging very well, where the patient doesn't get the thermal effects but gets the benefit of the low dosage shortwave diathermy. Precautions on the diathermy, you must be aware of the dressing types being used. Some dressings do include a silver base to them, and or some call it algenonics, and again that silver will heat up faster with the diathermy versus just using the tissue you're trying to treat. So it can cause a contraindication. So again, it's not recommended that you use even the microcirculation with the use of the silver dressings. The idea of the protocol is that it does promote the local microcirculation, increase tissue oxygenation, you get increased phagocytes, it will help decrease the pain. You get, again, possible changes in the cell membrane function and cellular activity, which will include increased protein synthesis, increased AP generation. We have a couple references that we will refer to. There's the Gallo and Prue study, which is again an overview of a bunch of different studies, but again it does reference some really good articles in regards to the use of microcirculation in the Hoffen and the Journal of Applied Physiology. Again, shows the benefits of shortwave diathermy and increased mitochondrial production, again heading back to the ATP work that's being done. Again, one thing about this protocol compared to the other protocols being used, it is a 30-minute dosaging. As we move up the dosimetry tables, the next step up would be moving into the anti-inflammatory protocols or the joint stiffness, which puts you in that low and moderate dosaging. Again, some really favorable results in relieving pain in osteoarthritis, and again, showing some real good effectiveness in regards to just dosing to where they get a sensation of warmth or a mild sensation of warmth, which will jump in between dose 2 and dose 3. And then as you move closer to into dose 3, there's the protocols of joint stiffness. Again, a lot of the studies will reference down to taking it to either a low sensation of heat. When you start to get into that joint stiffness, it's a mild to moderate, but nothing that the patient it's just a nice warm sensation. If you look at looking for a reference in regards to a great study, Jan et al. Physical Therapy 2006 would be a great reference point for you for that particular protocol and the use of shortwave diathermy with osteoarthritis. All right, now we're at the point where we're starting to move up the power levels and get into the higher dosaging where we start to really generate some warmth with shortwave diathermy. And this is probably the biggest challenge when I go out and work with therapists in regards to our device compared to our competitors. You're used to seeing only maybe 3 or a total of 4 dosages out there. You may start out at 3, or 3 as we call 3A. And then again, because of the tissue size, the amount of adipose tissue, the size of the patient, it just may not be enough. You have the ability to then move to 3B with us. And you can titrate them slowly we're trying to get to that particular outcome of heating the tissue to get it ready for stretching. And so again, you may run into the next time is that, again, depending on the size and again, all the variables within the patients, is that you may need to move to 3B. And that may achieve your 3 to 4 degree change that you need to get that good stretch or good outcome for that particular protocol. But last but not least, you still have 4. You still have that vigorous heat depending on the size of the patient. Again, I keep harping on Draper, but his studies are really good in regards to talking about the condition, the amount of dosaging, trying to get that tissue warm so you can stretch it and get the fibers to be loose. You need to get that 3 to 4 degrees Celsius of change in the temperature of the tissue, or you're not going to achieve the outcome that Draper outlines in his studies. Even when he compared hamstrings, again, he did normal stretching and added shortwave diathermy. The outcomes were so much better by getting that tissue to that 3 to 4 degrees Celsius change that, again, they got dramatic changes in range of motion, and it's sustained range of motion. But the idea is to achieve these great results that diathermy can offer you in that stretch window of application.